abc.com to see when the challenge is coming to a school near you.
Well, there is a new method of doing breast cancer surgery.
Right, and it's easier on patients, we're told. 13 ABC's Melissa Vage taking a look at how it works tonight.
Well, Lee and Diane, when you go to have a cancerous tumor removed from your breast, doctors have to mark the location of the tumor so the surgeon knows what area to take out. Well, this new procedure is called the Magseed, and it takes at least one layer of the trauma out of breast cancer surgery.
And the wire itself is not very comfortable.
ProMedica radiologist Dr. Robin Shermis says these images say it all. The thin wires you see in these pictures are what doctors used to use to mark breast cancer tumors.
The wire would stick out of the body, and it may remain there for a couple hours before surgery.
Dr. Shermis says the procedure was very traumatic for the patient.
Call it like harpooning prior to surgery, and it wasn't very ideal.
Although it was necessary for surgeons to find the cancerous tumor. ProMedica surgeon Dr. Michael McPhee.
They're picking up these cancers smaller and smaller. So if you have a breast cancer that you can't see as a surgeon in the operating room and you can't feel it, how are you going to remove it?
And the wire localization method was okay, but not great.
We're provided with two planes of projection, a vertical plane and a horizontal plane that show this wire on a mammogram. And now in our mind, we have to somehow conform a three-dimensional lumpectomy from these two images. Very challenging.
Now doctors can inject a tiny magnetic marker called a Magseed right into the tumor site, marking the cancer.
We can deploy the Magseed clip several weeks in advance, prior to surgery, or a week in advance, or even a day in advance. And then the surgeon can use that Magseed as his roadmap to taking out the correct tissue that has disease in it.
Surgeons like Dr. McPhee can use a tool to detect the magnet and remove the tumor from the exact site, along with the Magseed marker.
It allows me to accurately remove the cancer with an acceptable margin and also preserve the normal breast tissue, which equates to an improved cosmetic outcome.
The new procedure is now being done at all the ProMedica Breast Care centers. Reporting live, Melissa Vage, 13 ABC Action News. Back to you, Lee and Diane.
All right, Melissa, thanks very much.
Well, another week of competition in the Goodwill Pass It On Challenge.